morning, ladies and gentlemen. I'm Iyayi Nishimbia. I'm here to talk about the understanding of mental health and coping strategy. Mental health is an important parameter in one's life, especially for patients with physiological pressure. As a nursing student, it is critical to recognize the origin of stress, its impact on the body, how to assess and respond to the stress. This articulate dares to dive into leading source of physiological stress, their correlation, effects, and a material of coping strategies whilst evaluating their efficacy. Major source and consequences of physiological stress. Physiological stress is as a result of multiple factors which are commonly grouped as academic and occupational stress. People who work professionally, especially those in healthcare and students, have challenges related to their schedules which affect their expected performance. The interpersonal relationship. The interpersonal relationship with families, friends, or colleagues, which results or involve conflict, can add to emotional distress. APA 2020. Financial and economic challenges. The challenges in finance and socio-economic is the unemployment, instability, and debt increase their rates for anxiety. Traumatic events. Life scattering points. Traumatic stress disorder can be caused by events like the death of a loved one, abuse, or violence exposure. Health-related stress. It refers to stress which comes from an ongoing chronic illness, pain, or disability. Translation of effects of physiological stress. Now, the chronic stress affects mental and physiological well-being and can cause anxiety, depression, irritability, and a sense of helplessness. All these affect the emotion. APA 2020. It can also cause cognitive impairment, which is as a result of trouble concentrating, memory problem, and negative thinking. Part Y. Psephology 2004. Why zebra don't get ulcer? An updated guide to stress diseases and coping. The physiological effect of it is increased heart rate. Coping strategy and their effectiveness. Coping strategy and their effectiveness. Coping approaches falls into three main categories: problem focused, emotion focused, and maladaptive strategy. Problem focused coping, I put this in bracket as the active strategy. Please, the active strategy. Setting realistic goals in an organized manner could reduce academic and work-related stress. Markan et al. 1990. Strategies coping, seeking social support, engaging with friends, families, or support groups can offer part of emotional and practical assessment. Till 2011, seeking professional help like therapy and counseling to cope better with stress and anxiety. The cognitive behavior therapy will help anxiety. Becky, 1976. Sorry for that. Emotion focused coping strategy. The physiological and behavioral approach. Mindfulness and meditation is one practice which is well known to reduce stress. It occurs when a person deliberately pays attention to the present moment, non-judgmentally. Kabat-Zinn 1990. The realize of endorphins, which increase mood and reduces anxiety, is influenced by regular exercises. Reha 2008. The journaling about people through and emotions are expressive written can be beneficial. Now let's go to maladaptive coping. Maladaptive coping. Self-reflection and relative stress strategy. Ineffective approaches. When substance abuse, individual use of alcohol, nicotine, or drugs to cope, they may find themselves develop addiction and which can worsen stress in the long run. Avoid reaction, not facing stressor, but letting time often results in an increased anxiety and depression. Caviar et al. 1987. Now, the assessment of effectiveness. There are maladaptive strategies, general problems, and emotion-focused approaches have been shown to be more effective in responding to stressor. Research shows that mindfulness and exercises marked enhance mental health outcomes while avoidance and substance abuse led to long-term physiological trauma. Lazarus and Folkman, 1984. And also I got this from Kabat-Zinn, 1990. Now in conclusion, I would say one of the very important things for nursing students and healthcare professionals is to have knowledge about sources and effects of physiological stress, psychological stress, developing good coping strategies ultimately leads to improved well-being of their careers and improved care of the patients. Thank you very much.